Today we will take up immunity. Okay. Immunity is defined as immunity is defined as ability of body to resist infection. Immunity is defined as ability of body to resist infection. There are two kind. They are classified as innate immunity and acquired immunity. Innate further classified into species, racial, and individual. Species, racial, and individual. Species, racial, and individual. Species, racial, and individual. And acquired immunity. Innate is you get it as a birthright. Innate, you get it as a birthright. ಹಲೋ ಹೇಳಿ ಹೇಳಿ ಹೌದೌದು ಹೌದು ಆಯ್ತಾಯ್ತು ಅಲ್ಲ ಎಚ್ ಆರ್ಗೆ ಹೋಗ್ತಾರಂತ ಅವರು ಎಚ್ ಆರ್ನಲ್ಲಿ ಬ್ಯಾಗ್ ಬಿಟ್ಟು ಬಂದಿರಂತಲ್ಲ ಹೋಗ್ತೀನಿ ಅಂತ ಹೇಳಿ ಓಕೆ ಓಕೆ ಆಯ್ತು 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 So innate and acquired. Innate is further classified into species, racial, and individual. Acquired is classified into active and passive. Innate and acquired. Acquired is classified into active and passive. Active and passive. So innate immunity, it says as a birthright you get it. As a birthright you get the immunity. Now coming to the species, man is immune to the plant pathogen. We don't suffer from any diseases which plants suffer from. Now frogs are amphibians. As long as they are living in the water, they are resistant to anthrax. The moment they come onto the surface, they are sensitive to anthrax. The racial, earlier it was said that Negroes are susceptible because probably they were poor and not nutritious, and now it's a myth. Obama became US president. It's not holds good now. Now, earlier it was said that it is tuberculosis common among poor and Negroes. Now, individual. Now, for example, if there are twins, homozygous twins arising from the same ovum, heterozygous from different ovum, the homozygous twins share the common immunity, whereas heterozygous different immunity. Age, two extremes of the age, these are called as non-specific immune mechanism. These are called as non-specific immune mechanism, NSIM. These are called non-specific immune mechanism. Two extremes of age, pediatric and geriatric, are highly susceptible to infection. Children, pediatric age group because immune system is not developed. Geriatric because immune system because of wear and tear it is destroyed. So extreme age group, the infections are common. Next is hormonal factors. For example, if person is suffering from diabetes, hypothyroidism, adrenal insufficiency, are all susceptible for infection. So diabetes mellitus, where sugar levels are very high, the organisms infect the person. Diabetes mellitus infections are very common. Malnutrition, kwashiorkor and marasmus. infections are very common. Kwashiorkor and marasmus. Infections are, you know what is Kwashiorkor and marasmus? What is Kwashiorkor? One is calorie deficiency, another is protein deficiency. Which is protein deficiency? Marasmus, calorie deficiency. So now coming to the skin. Skin is the most important part in the protecting against invading microorganism. Abraded skin makes nidus for the microorganism to colonize and cause infection. The most of the time when the skin, which is the most common cause for skin get denuded or injured. What is the commonest cause of skin injury? Huh? Roadside one, then accidents. RTA, roadside accident. Any other? Any other? Roadside accident, any other? Huh? Burns here. Okay. Now, skin has got sweat and sebaceous gland. They are bactericidal. Secretions are bactericidal. That protects us from the. Now, respiratory tract is not in a. It's in a zigzag pattern. It's not straight. So, the moment any organism tries to enter the body, sneezing is a non-specific protective phenomena. It will not allow the organism to invade, colonize, and cause infection. And it has got a cilia, so it gives rise to sneezing. Mucous membrane, oral cavity, it has got a rich antibodies, IgA antibodies, which are called local antibodies, and it has got a lot of antibacterial substance. Now, gastric mucosa has got gastric secretion, hydrochloric acid, HCl, which will not allow organism to kill them. Put them out, go out. Don't allow them. Hydrochloric acid, which will kill the bacteria, will not allow the bacteria to colonize, invade, and it will kill the bacteria, bactericidal. Now, small intestine is full of commensals. There are organisms called commensals. They are very important. Commensals, they are very important because once the organism intestine is full of microorganism, it will not allow the pathogens to invade, colonize, and cause infection. Commensals have three advantages. Hold it like this: three advantages. Number one, it produces intrinsic vitamins. Number two, it will produce intrinsic antibodies. Number three, it will help in the absorption of nutrients. So, the most important is competitive inhibition. As long as E. coli is there in that intestine, it will not allow the Salmonella, Shigella, and enteric pathogens to colonize and cause infection. Very important. So, conjunctiva is already dipped in tears. Tear is full of lysozyme. Lysozyme is a bactericidal. It kills the bacteria. And urine. It's repeated urine flushes out of the bacteria. Urination flushes of the bacteria. In fact, there was a myth among a lot of people. After having sex, they used to wash their genitals with the urine, thinking that it will kill the Trypanosoma pallidum, gonococcus and all. It's not true. Semen and other vaginal secretions are acidic in nature. They will also kill the bacteria. And now there are antibacterial substances present in the blood. What are the antibacterial substances that are present in the blood? Number one, the most important antibacterial substance present is complement. Complement is a non-specific protein, right? And complement is a non-specific protein. Complement is a non-specific protein gets activated by specific antigen antibody reaction. Results in lysis of bacteria. Other biological functions of complement are complements are other biological functions of complement are it lyses the bacteria one, immobilization of the bacteria, any organism which is motile, it immobilizes, viral neutralization, enhancement of the viral neutralization, enhancement of the kininogens, anaphylotoxin. So many functions are there, biological functions of complement. The next is uh, phagocytic organism. There are macrophages and macrophages. Macrophages, phaging is eating. Okay. Macrophages are neutrophil, polymorphonuclear leukocytes. What they do is phagocytosis. Phagocytosis. They do phagocytosis. Engulfing of bacteria is called phagocytosis. And in the phagocytes, there are lysozymes which kill the bacteria. It was discovered by Ali Meshinkov. It's a non-specific, irrespective whatever the microorganism is there. They come and engulf the bacteria. Macrophages and neutrophils are the first line of attack, and they accumulate in large number around the site of inflammation. Inflammation is also non-specific phenomenon. Wherever organism tries to enter, there will be formation of Kaller-Ruber-Dollar tumor. Kaller-Ruber-Dollar tumor. These are the four cardinal signs of inflammation. Kaller-Ruber-Dollar tumor. Kaller-Ruber-Dollar tumor. So inflammation is a very important process in the protection against bacteria, and it attracts chemotaxin at the site of infection. Chemotaxin with the process is called as chemotaxis. The process is called as chemotaxis. The process is called as chemotaxis. Next is fever. Fever is a non-specific immune defense mechanism. In fact, before the discovery of penicillin, people used to inject malarial parasite to increase the body temperature to kill the Treponema pallidum, which causes syphilis. Fever is a non-specific protective mechanism. So this is all in a nutshell. This is the non-specific immune mechanism. So what are the non-specific immune mechanism? Number one is skin, sebaceous sweat glands. Number two, respiratory tract. Number three, oral cavity, mucous membrane of the oral cavity, which has got a lot of saliva, has got also a lot of antibacterial substance. Then hydrochloric acid in the stomach. Hydrochloric acid in the stomach, and commensals in the intestine. Commensals, tears, the eye, which has got a lysozyme, bactericidal. Flushing of urine. Then acidity of vagina. Acidity of vagina. Then bactericidal present in the blood are complement, neutrophils, macrophages, neutrophils, macrophages, and fever and inflammation. These are all examples of non-specific immune defense mechanism. These are all important factors. First line defense mechanism. So, these are all very important. When body temperature increases, fever, in the case of fever, microorganism present in the body, they die. Fever is a non-specific immune mechanism. Now this is all present in the human body. Now coming to the acquired immunity. Somebody put on the fans. No? Acquired immunity is that what you get after birth. That is called acquired immunity. What you get after birth. Acquired immunity, what you get after birth. Acquired immunity, what you get after birth. So they are classified into, acquired immunity is one, they are classified into active and passive. They are classified into active is good, which is long lasting, and which has got immunological memory. When organism attacks second time, immediate response will be there. Passive immunity is preformed immunoglobulins are given. Preformed immunoglobulins are given. It has no immunological memory. It is given in emergency condition when immediately needed. The most common immunoglobulins we administer: anti-diphtheric immunoglobulin, anti-tetanus immunoglobulin, anti-rabies immunoglobulin. Preformed immunoglobulin we administered when we have no time to vaccinate and produce antibodies. Anti-diphtheric immunoglobulin, anti-rabies immunoglobulin. The disadvantage of passive immunity is it is short-lived, but it is immediate. Short-lived, but it is immediate. Short-lived, but it is immediate. There is no immunological memory. Now, active immunity again classified into natural and artificial. Active immunity is further classified into natural and artificial. Natural and artificial. So, natural immunity, when you suffer from disease, for example, if you suffer from mumps, when you suffer from mumps, you will get lifelong immunity. You suffer from chicken pox, you get lifelong immunity. You suffer from mumps or chicken pox, you get lifelong immunity. You get lifelong immunity. Or subclinical infection, you get repeatedly infected, you get lifelong immunity. There is something called premonition or infection immunity. Premonition or infection immunity. Premonition or infection immunity. Premonition or infection immunity. What is this premonition or infection immunity? This occurs in two infectious diseases, in microbial diseases. One is syphilis, another is malaria. When man is suffering from malaria or syphilis, he will not get infected with the same organism during the suffering period. This is called premonition or infection immunity. So please remember the disadvantage of passive immunity. Advantage is immediate, it protects. When you have no time, it is given immediately. It is also helpful in people with HIV patients, immunoglobulin, because they don't have enough uh, immune apparatus is not well prepared to prepare the antibodies. The preformed antibodies are administered. And before the discovery of penicillin, what you used to do is to take the uh, serum of convalescent patient and inject into the acutely ill patient. This was called serotherapy. Now it is abandoned because so many viruses are there, slow viruses are there, hepatitis B, HCV, and HIV virus is there. Serotherapy has been abandoned nowadays. This is all passive immunotherapy. Passive therapy. Passive therapy is not long lasting, no immunological memory, it is short lived. Please remember that. Now, active immunity is by all vaccine. Active immunity is by all vaccine. It's derived from the name Vaka. Vaka means cow. Father of vaccinology is Sir Edward Jenner, who came to know by milkmaid Sarah Mims that she has suffered from cowpox. She will not suffer from smallpox. She used the cowpox virus, which is antigen similar to smallpox. Got hold of a boy called James Phipps, inoculated him with cowpox virus, challenged with smallpox virus after a couple of months. Boy survived. Today we are free from smallpox. It's globally eradicated. So, all of you have not taken smallpox, but I have taken vaccine. Smallpox vaccine. 84, I think. It's globally eradicated from all. Right. All prophylactically given antigens are called as vaccines. So on 0 day, as baby is born, we give BCG and OPV. As soon as the baby is born, we give oral polio vaccine. It's called Sabin vaccine, and BCG, Bacillus calmette and Guerin, which is given to prevent tuberculosis. 6th and 10th and 14th week, we give pentavalent vaccine plus OPV. So it becomes 6-7. Pentavalent consists of DPT plus hepatitis B plus Haemophilus HIB, Haemophilus influenza B. DPT, diphtheria, pertussis, tetanus, hepatitis B, Haemophilus influenza B. That is given for neonatal meningitis, to prevent neonatal. 1610. 9th month, we give measles vaccine. In between, new vaccines have come: rotavirus, and pneumococcal vaccine. Rotavirus and pneumococcal vaccine. Then hepatitis A vaccine also called, it is called Avirex. And hepatitis A and B together, it's called as Winrix. At 12th month, you give MMR vaccine, mumps, measles, and rubella vaccine. At 12th month, we give, and at 1.5 year, 18 month, we give DT plus OPV. 3rd year, we give typhoid vaccine. 6th, 12th, and 18th, we give DT, diphtheria and tetanus toxoid. And we have started what is called as pulse polio program, pulse polio program. First week of every year, first Sunday of January, first Sunday of January and first Sunday of February, we give 2 additional drops of oral polio vaccine. We give additional vaccine. And if you are planning to go to South Africa, you have to take yellow fever vaccine. So one of the viral diseases transmitted by mosquito, and if you are traveling to then one vaccine we give, it's called post-exposure prophylaxis. That's called anti-rabies vaccine. This was discovered by Louis Pasteur. This is the only vaccine which you take, which all of us take after the dog bite. All the vaccine taken prophylactic before you get infection. So please remember, this is called active immunity. Active immunity is obtained after taking vaccine. So our immunological apparatus prepares antibodies against these particular antigens, and it is very good. It's long lasting and immunological memories. Now you can add Covishield and Covaxin. Another 2 vaccine you can add. How many doses you have taken? 3 doses or 2 doses? We have taken 3 doses because after 1 year we are supposed to take 3 doses. So many have taken 2 doses. So we are immunized against with 3 doses. Now moving on to the passive immunity. Passive immunity, I told anti-diphtheric immunoglobulin, anti-rabies immunoglobulin, anti. So that passive immunity also can be classified as natural and artificial. Natural and artificial. So fetus obtains from mother during intrauterine life, and first 3 months of life, of fetal life, that's why it is immune from all infectious disease. And breast milk also contains IgA antibodies. So it starts manufacturing antibodies at 12th week. Okay, first 3 months, fetus is immune to all infective microorganisms because of intrauterine transfer of antibodies from mother to fetus. So that's why we give during antenatal checkup 2 shots of tetanus toxoid. Tetanus toxoid. Antenatal checkup is checkup that is done during pregnancy. 2 shot. This is to prevent neonatal tetanus. It's also called as tetanus neonatum. It is also called as tetanus neonatum. It is also called as tetanus. So passive immunity can be artificial, can be with a homologous serum or heterologous serum. I said anti-diphtheric serum, anti-tetanus serum, and anti-rabies serum. So earlier we used to give what is called serum obtained injecting into the horses, well-bred horses, Hofkin Institute, which prepared a Covishield. Well-bred horses, we used to inject the diphtheria and tetanus. We used to take the serum and purify and give serum from the horses. But the disadvantages are that people used to develop serum sickness. Sometimes they used to get anaphylaxis also, heterologous serum. Homologous serums prepared from the human beings, but there are chances of disadvantages of these chances of viruses. All these vaccines of serum should be screened. Immunoglobulin is screened for hepatitis B, hepatitis C, and hepatitis A. So all these are very important. So heterologous serum is that's what said. Serum sickness is a disadvantage for sometimes anaphylaxis also. There is something called herd immunity. What is herd immunity? For example, there are 100 people in a community. If you immunize 90 people, that target, the 10 people who are not immunized also automatically get immunity. The immunity occurring in a local population. It is called herd immunity. So if you target, you want to immunize 100 people, for example, Covishield or Covaxin, 130 crore people, 2 doses. That means 260 crores doses are required to vaccinate. Even if you do about 230 to 40 crores of immunization in 2 doses, the other 20%, 10% will automatically get immunized. So we have not reached that 230 marks yet. So 100 crores we have crossed long time back. A lot of people are hesitant to take vaccine because some people are scared to take vaccine to develop all those things. So that finishes immunity. So please remember, immunity is defined as ability to body acquired, innate and acquired. Acquired is by natural. To suffer from infection, for example, entry fever, mumps, measles, rubella, or any other infection, you get lifelong immunity. Especially mumps is said to be lifelong immunity. So artificial is all by vaccines. There are at least half a dozen of vaccines. So you have said pentavalent vaccine, then oral polio vaccine. The parental vaccine is called, oral is called Sabin, parental is called SAL. This is oral, this is parental, intramuscular, parental, SAL, oral, and parental is Sabin. Okay, thank you. That finishes. Next time we'll take antigen antibody reaction. Thank you very much.